Combined Med Surg new keywords. Question 1. A patient with chronic kidney disease has a serum potassium of 6.8 milliequivalent/L. Which advanced nursing intervention is the priority? Administer sodium polystyrene sulfonate. Place on continuous cardiac monitoring immediately. Encourage a low potassium diet. Restrict 4 fluids. Hyperkalemia at this level carries a risk of fatal dysrhythmias. Cardiac monitoring is the immediate priority. Question 2. An advanced Med Surg nurse assesses a postoperative patient who suddenly develops acute chest pain, dyspnea, and tachycardia on day 2 after hip replacement. The nurse's first action is: administer prescribed analgesia. Obtain a 12-lead ECG and notify the physician stat. Reposition the patient to the left lateral position. Increase the 4 fluid rate. Acute chest pain with dyspnea postoperatively suggests pulmonary embolism. ECG and immediate notification are priority. Question 3. A patient with severe burns receives Parkland formula fluid resuscitation. Which assessment confirms adequacy of resuscitation? Urine output of 30 to 50 ml/hour. Systolic blood pressure above 160 mm of mercury. Absence of edema. Heart rate below 50 bpm. Urine output of 0.5 to 1 ml/kg/hour, approximate 30 to 50 ml/hr, is the gold standard for burn resuscitation monitoring. Question 4. An ATI-style question. A client has a nasogastric tube in place. Before administering a tube feeding, the nurse should first aspirate gastric residual and check pH. Flush with 60 milliliters of water. Warm the formula to body temperature. Auscultate for bowel sounds. Checking gastric residual and pH confirms tube placement and safe gastric emptying before feeding. Question 5. An ATI question. A client is receiving heparin infusion for DVT. The APTT result is 120 seconds, therapeutic range 60 to 100 seconds. The nurse should continue the infusion at the current rate. Decrease the infusion rate per protocol. Stop the infusion and notify the provider. Administer protamine sulfate. An APTT of 120 seconds is supertherapeutic. Stopping the infusion and notifying the provider prevents bleeding complications. Question 6. ATI Med Surg. A client with cirrhosis develops hysterexis and confusion. The nurse anticipates which intervention? Increase dietary protein intake. Administer lactulose as prescribed. Prepare for liver biopsy. Restrict 4 fluids. Lactulose reduces ammonia absorption in the gut, treating hepatic encephalopathy indicated by hysterexis and confusion. Question 7. ATI proctored practice. A client with myasthenia gravis is in crisis. Which finding distinguishes myasthenic crisis from cholinergic crisis? Muscle weakness that improves with edrophonium. Excessive secretions and bradycardia. Pupil dilation. Hypertension. Myasthenic crisis improves with edrophonium, tensilin test. Cholinergic crisis worsens with it. Question 8. ATI proctored. A client develops fluid overload after IV therapy. Which assessment finding is most significant? Weight gain of 2 kilograms in 24 hours. Mild ankle edema. Crackles in the lung bases. Increased urine output. Crackles indicate pulmonary edema, a serious complication of fluid overload requiring immediate intervention. Question 9. ATI proctored, a post-op client reports sudden onset severe pain and a rigid, board-like abdomen. The nurse should administer prescribed opioid analgesic. Notify the surgeon immediately. Apply warm compresses to the abdomen. Encourage ambulation. A rigid abdomen postoperatively suggests peritonitis or anastomotic leak, a surgical emergency. Question 10. ATI proctored Q&A. A client with COPD has an SpO2 of 86%. The nurse should administer oxygen at high flow 100% via non-rebreather. Low flow 1 to 2 liters per minute via nasal cannula. 15 liters per minute via bag valve mask. No oxygen, it is contraindicated. COPD patients rely on hypoxic drive. Low flow oxygen, 1 to 2 liters per minute, maintains SpO2 at 88 to 92% without suppressing respiratory drive. Question 11. ATI Q&A. A client with Addison's disease is admitted in crisis. The priority intervention is administer 4-hydrocortisone as prescribed. Restrict sodium intake. Encourage increased fluid intake. Administer insulin. Addisonian crisis requires immediate 4-hydrocortisone replacement to reverse life-threatening adrenal insufficiency. Question 12. ATI Q&A. A client is in the oliguric phase of acute kidney injury. The nurse monitors for which electrolyte imbalance first? Hypokalemia, hyperkalemia, hypernatremia, hypomagnesemia. Oliguria in AKI leads to potassium retention, making hyperkalemia the most dangerous immediate electrolyte imbalance. Question 13. A CMSRN candidate question: which intervention is the priority for a patient with acute compartment syndrome of the lower leg? Elevate the extremity above heart level. Notify the surgeon for immediate fasciotomy. Apply an ice pack to reduce swelling. Administer NSAIDs for pain. Fasciotomy is the definitive treatment for compartment syndrome. Delay causes irreversible muscle and nerve damage. Question 14. CMSRN exam. A patient with type 2 diabetes is NPO for surgery. Which insulin management is correct? Hold all insulin doses until the patient resumes eating. Administer basal insulin at 75 to 80% of the usual dose. Double the usual insulin dose to cover surgical stress. Administer sliding scale insulin only. Basal insulin is typically continued at 75 to 80% of the usual dose in NPO surgical patients to prevent hyperglycemia. Question 15. CMSRN. A patient develops a pulmonary embolism. Which clinical finding is most specific? Tachypnea, pleuritic chest pain and hemoptysis, fever above 39 degrees Celsius, bilateral leg edema. Pleuritic chest pain and hemoptysis, while not always present, are more specific to pulmonary infarction from PE. Question 16. Free SERP practice. A nurse assesses a patient with a serum sodium of 120 milliequivalent/L and confusion. Which action is the priority? Administer hypertonic saline slowly as prescribed. Encourage oral fluid intake. Restrict 4 fluids. Monitor and reassess in 4 hours. Severe symptomatic hyponatremia, less than or equal to 120 with neurosymptoms, requires controlled hypertonic saline to prevent seizures and brain herniation. Question 17. SERP practice. A patient post-coronary artery bypass graft, CABG, has a urine output of 15 milliliters per hour for 2 consecutive hours. The nurse should first Administer prescribed 4 fluid bolus. Notify the physician immediately. Increase the 4 maintenance rate independently. Document and reassess in 1 hour. Post-cab urine output below 0.5 ml per kilogram per hour suggests low cardiac output or renal hypoperfusion. The physician must be notified promptly. Question 18. CERT practice. A patient develops heparin-induced thrombocytopenia, HIT. The nurse should first reduce the heparin dose by half. Discontinue all heparin products immediately. Switch to warfarin immediately. Monitor platelet count daily. HIT requires immediate cessation of all heparin products, including flushes, to prevent further platelet aggregation and thrombosis. Question 19. Med Surg. A patient with peptic ulcer disease vomits bright red blood. The nurse's immediate action is: insert a nasogastric tube. Establish 4 access and notify the physician. Administer oral antacids. Prepare for an upper endoscopy. Active GI hemorrhage requires immediate 4 access and physician notification to stabilize the patient. Question 20. Med Surg. A patient has a serum calcium of 7.2 mg per deciliter. Which clinical finding does the nurse expect? Constipation. Positive Chvostek sign. Hypertension. Bradycardia. Hypocalcemia causes neuromuscular irritability. Chvostek sign, facial twitching with cheek tap, is a classic finding. Question 21. Med Surg. A patient is receiving a blood transfusion and develops chills, fever, and flank pain 15 minutes into the infusion. The nurse's first action? Slow the infusion rate. Stop the transfusion and maintain 4 access with normal saline. Administer diphenhydramine. Obtain a urine specimen. These symptoms suggest an acute hemolytic transfusion reaction. Stopping the transfusion immediately is the priority action. Question 22. Board exam. A patient with heart failure has gained 3 kilograms in 2 days and reports increasing dyspnea. The priority nursing action is: restrict oral fluid intake to 500 milliliters per day. Notify the physician and prepare to administer prescribed diuretic. Encourage ambulation to reduce edema. Place the patient in Trendelenburg position. Rapid weight gain and worsening dyspnea indicate acute decompensated heart failure. Diuresis is the priority treatment. Question 23. Board. A post-thyroidectomy patient develops stridor and laryngospasm. Which intervention is first? Administer 4 calcium gluconate. Prepare for emergency tracheotomy. Apply a neck collar. Place in high Fowler's position. Stridor post-thyroidectomy indicates hypocalcemia from parathyroid damage, for calcium gluconate relieves laryngospasm. Question 24. Board exam. A patient with a T4 spinal cord injury develops sudden hypertension, BP 210-110, diaphoresis, and bradycardia. The nurse recognizes this as: hypovolemic shock, autonomic dysreflexia, neurogenic shock, septic shock. Autonomic dysreflexia is a hypertensive emergency in SCI patients above T6, triggered by noxious stimuli below the injury. Question 25. Cardiac test bank. A patient with a STEMI is given thrombolytic therapy. Which finding indicates successful reperfusion? ST segment elevation increases. Sudden onset of ventricular fibrillation. Resolution of ST segment elevation and relief of chest pain. Rise in troponin levels. Resolution of ST elevation and chest pain relief are the primary clinical indicators of successful thrombolysis. Question 26. Cardiac. A patient with atrial fibrillation is started on warfarin. The nurse teaches the patient to report which finding immediately? Mild bruising at injection sites. Red or dark colored urine or stool. Mild headache after activity. Dry skin. Red urine or dark tarry stool suggests major bleeding, a life-threatening complication of anticoagulation therapy. Question 27. Cardiac test bank. A patient develops third-degree, complete, heart block. The nurse anticipates which intervention? Administer 4-adenosine. Prepare for transcutaneous or transvenous pacing. Administer 4-atropine and reassess. Perform synchronized cardioversion. Complete heart block causes hemodynamic compromise. Pacing is the definitive intervention. Question 28. CERT practice. A post-op patient has a PCA pump for pain control. The nurse notes the patient is sedated with a respiratory rate of 8 breaths/min. The priority action? Administer a higher PCA dose for comfort. Administer naloxone as prescribed. Stimulate the patient and encourage deep breathing. Document and reassess in 30 minutes. Opioid-induced respiratory depression requires immediate naloxone administration to reverse the effect. Question 29. CERT practice. A patient with SIAD has a urine osmolality of 900 mosm/kg and serum sodium of 118 milliequivalent/L. The nurse's first intervention? Administer 4-hypotonic saline. Restrict fluids to 800 to 1000 ml/day. Encourage oral sodium supplementation. Increase 4 fluid rate. Fluid restriction is the cornerstone of SIAD management. Reducing free water intake corrects dilutional hyponatremia. Question 30. CERT. A patient with an abdominal aortic aneurysm reports sudden severe back pain radiating to the groin. The nurse's priority is? Prepare for emergency surgical intervention. Administer prescribed pain medication. Obtain a CT scan. Reassure the patient and monitor vital signs. Sudden severe back/flank pain in AAA suggests rupture, an immediately life-threatening event requiring emergency surgery. Question 31. CERT exam. Which wound assessment finding indicates infection rather than normal healing? Mild erythema at the wound edges at day 2. Purulent drainage with surrounding warmth and edema. Serosanguineous drainage on day 1. Wound edges approximating well. Purulent drainage with erythema, warmth, and edema are hallmark signs of wound infection. Question 32. CERT exam. A patient is started on 4-amphotericin B. Which adverse effect requires immediate intervention? Mild nausea during infusion. Rigors and chills during infusion. Serum creatinine rising from 0.9 to 3.2 mg per deciliter. Phlebitis at foresight. A significant rise in creatinine indicates nephrotoxicity from amphotericin B. The infusion may need to be stopped or dose adjusted. Question 33. CERT. A patient with DIC has a platelet count of 40,000/mm superscript 3 and active bleeding. The nurse prepares to administer? Fresh frozen plasma and platelets as prescribed. For heparin bolus. Packed red blood cells only. Vitamin K injection. DIC management includes replacing clotting factors, FFP, and platelets to address the consumptive coagulopathy. Question 34. A patient post-laparoscopic cholecystectomy reports right shoulder pain. The nurse explains this is caused by surgical injury to the shoulder, referred pain from residual diaphragmatic CO2 irritation, postoperative infection, peripheral neuropathy. Carbon dioxide used in laparoscopy irritates the diaphragm, causing referred pain to the right shoulder, phrenic nerve. Question 35. A patient has a Jackson-Pratt drain post-mastectomy. The nurse notes 200 milliliters of bright red output in 1 hour. The nurse should empty the drain and record output. Notify the surgeon immediately. Apply pressure over the drain site. Increase the fluid rate. 200 milliliters of bright red drainage in 1 hour is excessive and indicates possible hemorrhage. The surgeon must be notified. Question 36. A patient with chronic liver disease has an INR of 3.8. Which activity poses the greatest risk? Walking in the hallway, shaving with a straight razor, eating a soft diet, performing deep breathing exercises. An elevated INR indicates prolonged bleeding time. Straight razor shaving poses a serious bleeding risk. Question 37. A patient is in hypovolemic shock with a BP of 80/50 mmHg and HR of 128 bpm. Which intervention is the first priority? Insert a Foley catheter. Establish 2 large-bore 4 lines and administer 4 fluids rapidly. Obtain arterial blood gases. Administer vasopressors. Rapid fluid resuscitation via large-bore 4 access is the priority to restore circulating volume in hypovolemic shock. Question 38. A patient with bacterial pneumonia has an SpO2 of 88% on room air. The nurse's first action is prepare for intubation. Apply supplemental oxygen as ordered. Obtain a sputum culture. Administer prescribed antibiotics. Hypoxemia requires immediate supplemental oxygen to restore tissue oxygenation while other treatments are initiated. Question 39. The nurse is caring for a patient with a closed head injury. Which assessment finding warrants immediate action? Glasgow Coma Scale score of 15. Pupils equal and reactive to light. Widening pulse pressure with bradycardia. Mild headache. Widening pulse pressure with bradycardia, Cushing's response, signals severely elevated ICP requiring emergency intervention. Question 40. Question: a patient receiving total parenteral nutrition, TPN, develops sudden dyspnea and chest pain. What complication does the nurse suspect? A. Hypoglycemia. Air embolism from the central line. Fluid overload. Allergic reaction to the solution. Air embolism from a central venous catheter causes sudden chest pain and dyspnea. The nurse should clamp the line, position left lateral Trendelenburg, and call for help. Question 41. Question: a patient with a tracheostomy tube develops signs of tracheal obstruction. The nurse's immediate action? A. Deflate the cuff. Suction the tracheostomy using sterile technique. Replace the tracheostomy tube. Administer nebulized bronchodilator. Suctioning clears secretions causing obstruction and is the immediate priority to restore airway patency. Question 42. Question: a patient develops signs of thyroid storm, HR 160, temperature 40 degrees Celsius, and agitation. Which drug is given first? A. Levothyroxine. Propylthiouracil, PTU, followed by iodine solution. For insulin. Corticosteroids. PTU blocks thyroid hormone synthesis. It must be given before iodine solution to prevent iodine from worsening hormone production. Question 43. Final exam practice. A patient with a hip fracture is in Bucks traction preoperatively. The nurse ensures the weights are resting on the floor. The weights hang freely and the limb is in proper alignment. The patient is placed prone. The traction is removed every 4 hours. Traction is only effective when weights hang freely. Weights touching the floor eliminate the therapeutic pull. Question 44. Final practice. A patient with chronic pancreatitis asks about dietary modifications. Which instruction is correct? Eat 3 large high-fat meals per day. Consume small, frequent low-fat meals and avoid alcohol. Increase protein from red meat sources. Take oral enzymes only with dinner. Low-fat, small frequent meals reduce pancreatic stimulation. Alcohol must be completely avoided in chronic pancreatitis. Question 45. Final exam. A patient with end-stage COPD has a DNR order. The patient becomes increasingly dyspnoic. The nurse's priority action is? Initiate CPR. Provide comfort measures and administer palliative opioids as prescribed. Contact the ethics committee. Establish for access for resuscitation. In a patient with a DNR order, palliative symptom management, including opioids for dyspnea, is the ethical priority. Question 46. Final exam. A patient has a serum phosphorus of 1.5 mg per deciliter post-parathyroidectomy. Which complication is the nurse monitoring for? Hypercalcemia, refeeding syndrome, muscle weakness and respiratory failure, cardiac dysrhythmias from hyperkalemia. Severe hypophosphatemia causes respiratory muscle weakness that can progress to respiratory failure. Question 47. Final. A patient with a fresh arteriovenous (AV) fistula for hemodialysis is admitted. Which assessment is a priority? Checking brachial pulse. Auscultating a bruit and palpating a thrill over the fistula. Measuring blood pressure in that arm. Checking capillary refill in the fingers. A palpable thrill and audible bruit confirm fistula patency. Their absence indicates clotting requiring immediate intervention. Question 48. Med Surg final exam. A patient with Guillain-Barré syndrome has ascending paralysis reaching the chest. The priority nursing intervention is? Encourage range of motion exercises. Monitor respiratory status and prepare for mechanical ventilation. Administer prescribed corticosteroids. Initiate physical therapy. Ascending paralysis in GBS that reaches the respiratory muscles is a respiratory emergency. Ventilatory support must be prepared. Question 49. NCLEX Med Surg. A patient with acute pancreatitis is in severe pain. In addition to analgesics, which position provides the most relief? Supine with legs extended. Knee chest, fetal position. Prone position. High Fowlers with arms extended. The fetal position reduces tension on the inflamed pancreas and provides pain relief in acute pancreatitis. Question 50. NCLEX. A patient with a bowel obstruction has an NG tube to low continuous suction. Which electrolyte imbalance does the nurse anticipate? Hyperkalemia. Hypochloremic metabolic alkalosis. Hypernatremia. Metabolic acidosis. NG suction removes hydrochloric acid, leading to hypochloremia and metabolic alkalosis. Question 51. NCLEX Med Surg, a patient with chronic renal failure develops pericarditis. The nurse explains this is caused by bacterial infection, accumulation of uremic toxins irritating the pericardium, fluid overload, electrolyte imbalance. Uremic pericarditis results from accumulation of nitrogenous waste products that irritate the pericardium. Question 52. Med Surg nursing exam. A patient is placed in contact precautions for C. difficile. Which PPE is required when entering the room? Mask and gloves only. Gown and gloves. N95 respirator and face shield. Surgical mask only. C. difficile is transmitted via the fecal-oral route. Gown and gloves are required for contact precautions. Question 53. Med Surg nursing. A patient with hypomagnesemia is at risk for which complication? Bradycardia, ventricular dysrhythmias, constipation, fluid retention. Hypomagnesemia increases cardiac excitability, predisposing patients to ventricular dysrhythmias including torsades de pointes. Question 54. Nursing exam. A patient with a pleural effusion undergoes thoracentesis. After the procedure, the nurse monitors for hypoglycemia, pneumothorax, hypertension, bradycardia. Pneumothorax is the most serious complication of thoracentesis, caused by inadvertent lung puncture. Question 55. Respiratory exam. A patient with tension pneumothorax is identified by which set of findings? Bilateral breath sounds, tachycardia, hypotension. Absent breath sounds on one side, tracheal deviation away from affected side, hypotension. Increased breath sounds, bradycardia, hypertension. Bilateral crackles, fever, productive cough. Tension pneumothorax causes ipsilateral absent breath sounds, tracheal deviation to the opposite side, and hemodynamic collapse. Question 56. Respiratory. A patient with status asthmaticus does not respond to bronchodilators. The nurse anticipates which intervention? Oral theophylline. For magnesium sulfate. Inhaled corticosteroids only. Antibiotic therapy. For magnesium sulfate causes bronchial smooth muscle relaxation and is used in refractory status asthmaticus. Question 57. Respiratory exam. A patient on mechanical ventilation develops sudden high pressure alarms with absent breath sounds on the left. The first nursing action? Increase the tidal volume. Suction the endotracheal tube. Assess for endotracheal tube displacement or right mainstem intubation. Sedate the patient. High-pressure alarms with unilateral absent breath sounds suggest right mainstem intubation. Tube position must be assessed immediately. Question 58. Sample. A patient with deep vein thrombosis begins heparin therapy. Which lab value is used to monitor heparin effectiveness? Point/INR. APTT. CBC. Serum fibrinogen. The activated partial thromboplastin time (APTT) is the standard test for monitoring unfractionated heparin therapy. Question 59. Sample question. A patient with a colostomy expresses disgust about managing the appliance. The nurse's best response? You will get used to it eventually. Tell me more about what concerns you most about managing it. Many patients feel that way at first. You should be grateful the surgery saved your life. Open-ended therapeutic communication encourages the patient to express feelings, forming the basis for effective teaching and support. Question 60. Med Surg sample. A patient with cirrhosis has a distended abdomen and shifting dullness on percussion. The nurse suspects? Paralytic ileus, ascites, bowel obstruction, gastric distension. Shifting dullness on percussion is a classic clinical sign of ascites, a common complication of cirrhosis. Question 61. Test bank. A patient with acute respiratory distress syndrome, ARDS, is mechanically ventilated. Which ventilator strategy is used to prevent further lung injury? High tidal volumes to ensure full oxygenation. Low tidal volume, 6 ml per kilogram, lung protective ventilation. Continuous positive pressure without rate control. Hyperventilation to reduce CO2. Lung protective ventilation with low tidal volumes, 6 ml per kilogram ideal body weight, prevents ventilator-induced lung injury in ARDS. Question 62. Test bank. A patient with a stroke has dysphagia. The nurse implements which safety measure before meals? Administer thin liquids as tolerated. Perform a bedside swallow assessment and keep suction at bedside. Encourage the patient to eat rapidly. Place the patient in supine position for meals. Dysphagia post-stroke carries a high aspiration risk. Swallow assessment and suction availability are essential safety measures. Question 63. Test bank. A patient develops acute tubular necrosis, ATN. Which urine finding is characteristic? Urine with specific gravity greater than 1.030. Muddy brown granular casts in urine. Presence of white cell casts. Urine osmolality greater than 600 mosm/kg. Muddy brown granular casts are the hallmark urinalysis finding in acute tubular necrosis. Question 64. A patient with diabetes insipidus has a urine output of 10 L/day and a serum osmolality of 310 mosm/kg. The nurse administers? For hypotonic saline. Prescribed desmopressin, DAP. Fluid restriction. Furosemide. DAP replaces ADH in central diabetes insipidus, reducing excessive urine output and correcting hypernatremia. Question 65. A patient with rheumatoid arthritis is prescribed methotrexate. The nurse instructs the patient to avoid vitamin D supplements, alcohol consumption, low-impact exercise, NSAIDs for mild pain. Methotrexate is hepatotoxic. Alcohol significantly increases the risk of liver damage and must be completely avoided. Question 66. A postoperative patient has not voided in 8 hours and reports lower abdominal discomfort. The nurse's first action? Assist the patient to the bathroom or offer a bedpan. Insert a urinary catheter. Increase fluid rate. Administer prescribed diuretic. Encouraging voiding in a comfortable position is the least invasive first step before considering catheterization for urinary retention. Question 67. SERT practice. A patient with a large bowel obstruction has abdominal distension and an absent rectal tube output. Which intervention is priority? Administer a bowel stimulant. Notify the physician and prepare for possible surgical intervention. Administer a tap water enema. Increase oral fluid intake. A complete bowel obstruction requires surgical evaluation. Stimulant laxatives or enemas are contraindicated as they can cause perforation. Question 68. CERT, a nurse cares for a patient with severe anemia, hemoglobin 6.2 g/dl. Which assessment finding requires immediate intervention? Fatigue with moderate activity. Dyspnea at rest with SpO2 of 89%. Pale conjunctiva. Heart rate of 90 bpm at rest. Dyspnea at rest with low SpO2 in severe anemia indicates compensatory failure requiring immediate oxygen and possible transfusion. Question 69. CERT practice. A patient who underwent a Whipple procedure, pancreaticoduodenectomy, has a blood glucose of 280 mg per deciliter on day 2. The nurse's action? Encourage oral carbohydrate intake. Administer prescribed insulin and notify the dietitian. Hold the nasogastric feeding. Administer prescribed oral hypoglycemic agents. Post-Whipple hyperglycemia results from pancreatic resection, or subcutaneous insulin and dietitian involvement are appropriate.